Well, good afternoon, everyone. I'm Maureen Kahn, President and CEO of the Blessing Health System, and it's time for another update of what's going on in the organization. Well, it's day 63, and we're still with our stay-at-home order, so as most of us are doing, we're coming from home to work to home, still following our social distancing and still wearing our mask when we can't keep 6 feet apart. And no groups of 10 or more are meeting anywhere in our community. And as spring weather comes upon us, as you and I both know, it is getting harder and harder for the community to follow the rules. And as people in healthcare, I'm going to ask each and every one of you to help them. Help them understand the importance of why we social distance and why we wear a mask. It's our way of helping to prohibit or break the transmission of the disease. And the next 2 weeks, let's make it through the next 2 weeks. And if we can, maybe the governor will give us permission to implement our mayor's plan. Our mayor, our town, and our county have developed a very strong plan and reopen Adams County's businesses. We're ready, they're ready. And Blessing and Quincy Medical Group and the Public Health Department, we are all assisting the business leaders in educating them on how to get ready to open their businesses, how to make sure they know how to clean, how to make sure they know how to educate their staff. What are the signs and symptoms of COVID? How do you temperature screen at your front door to make sure that your staff is healthy? And we're giving them all the necessary information, making sure they know how to access CDC so that they will be ready when they get the green light to open up their companies. So they want to work just as much as you want to work. And we want them to go back to work because we want to have a strong economy in our community. So as the sun starts to shine here, you and I both know it's going to be hard, but let's all do our part to try and help them to make it through the next 2 weeks. And let's hope that the governor accepts our plan as the mayor has put it together. How are we doing? Well, on Monday, the governor gave us the green light to start back surgery. And the whole surgical team got together with the surgeons because we have a surgical advisory team, and they developed a plan to start surgery back. And we are starting slow, but we've done a ramp up over the next 2 to 3 weeks where we will be back to 100% of our surgical operations. And that takes teamwork because there are a few things that we need to have. We need to have testing because as the governor put in requirements, one of them was COVID testing on surgical patients. And the test needs to be done 72 hours prior to surgery. And then the patient has to quarantine for those 72 hours till we get the results back. And so we needed to have reliable testing sources to ensure that we had the test results back in time. So we didn't want to bombard our laboratories with tests that they couldn't process in a timely manner. So that's why we're gradually ramping up over the next 3 weeks. And so it's good to see the operating rooms back working. It's good to see our surgeons doing what they do best. And it's good to see our patients getting the care that they need. Some of our patients were a little nervous coming back into the hospital. But the things that we are doing, the things that they can visibly see, are giving them confidence that we are a safe place to get care. They can see the social distancing. They can see the cleaning that is going on regularly in the hospital, the wiping down of surfaces, the wiping of doorknobs. They can see you washing your hands frequently and the wearing of masks on all parties within the hospital. This gives them a degree of confidence that we are doing everything possible to keep them safe while they are here with us in the hospital. But with everything that you do, the one thing that is so important is that true human connection. that you are making with every patient every single day. Because while they're here with us, they also are not here with their families. And because their families are not visiting, you are filling a very important gap and assisting them with the use of technology so that they can connect back at home with their loved ones is very important, using iPads or iPhones. Again, I cannot say how proud I am of every individual in this organization, as we have celebrated National Hospital Week and National Nurses Week. I am just overwhelmed with the pride that I have in this group. You've done a tremendous job, and it really has struck me. So thank you very much. Have a great day.